Our daily work often involves profound human experiences, such as birth, death, and suffering. These moments challenge us to make sound moral decisions. Understanding ethics and values in nursing ensures that we provide the best care while maintaining our professional integrity. As nurses, we are at the forefront of sensitive situations, advocating for patients and families during critical moments. For example, in the Philippines, nurses often provide care in settings where family involvement in decision-making is paramount. This can differ from countries like the United States, where patients' autonomy is emphasized. These differences highlight the importance of understanding ethical principles to navigate such situations effectively. In today's healthcare environment, challenges such as cost containment and nursing shortages make ethical decision-making more critical. For instance, in the Philippines, the shortage of nurses due to overseas migration often means working longer hours with limited resources. Similarly, in countries like the UK, nurses face pressure to balance high patient loads with maintaining quality care. These challenges test our values, making it vital to stay grounded on ethical principles. To address these challenges, we need to focus on these areas. We need to develop sensitivity to ethical dimensions of our practice. For example, we need to recognize our patients' dignity when resources are scarce. We also need to examine our personal and our clients' values. For example, we need to understand a family's preference for traditional medicine. We also need to understand how values influence decisions. This is crucial when facing dilemmas like allocating limited ICU beds. We also need to anticipate moral challenges. In international contexts, like in the Middle East, nurses often navigate cultural differences that influence patient care. By developing these skills, we can respond ethically and compassionately. Values are enduring beliefs or attitudes about what is important. They guide our decisions and actions, especially when we are facing ethical dilemmas. For example, a nurse in the Philippines might value family involvement in end-of-life care, reflecting cultural norms. In contrast, nurses in Western countries often prioritize patient autonomy. Recognizing these differences help us provide culturally appropriate care while upholding our professional values. Although related, beliefs and values and attitudes are distinct concepts. Beliefs are conclusions we accept as true. For instance, believing that regular health checkups prevent disease. Values reflect what we prioritize, such as valuing honesty when discussing a patient's prognosis. Attitudes are feelings or mental positions, like compassion toward a patient refusing treatment. In practice, these elements influence how we interact with our patients and make decisions. For example, a Filipino nurse might display a compassionate attitude toward a patient relying on herbal medicine due to cultural beliefs. Values are not innate. They are learned through observation and experience. In the Philippines, Filipino traditions often emphasize respect for elders and care for family members, which influences nursing values. Globally, values may vary. For instance, in Japan, harmony and community are highly valued, affecting healthcare interactions. Recognizing these sociocultural differences influences and allows us to respect diverse patient perspectives while maintaining professional standards. Nurses hold two main types of values. We have the personal values and the professional values. Personal values is shaped by our upbringing. For example, Filipino nurses often embody values like respect and empathy, rooted in family traditions. Professional values are learned through education and practice. These include altruism, autonomy, integrity, and human dignity. For instance, nurses in the Middle East often navigate complex family dynamics while upholding professional standards, such as patient confidentiality. There are core values that are guiding our ethical nursing practice. We have altruism. This is the concern for others. This is seen when nurses stay beyond shifts to care for patients during typhoons in the Philippines. We have autonomy, respecting patients' right to make decisions, like allowing a terminally ill patient to refuse aggressive treatment. Another one is human dignity. This is treating all patients with respect, regardless of socioeconomic status, whether it's in a rural Philippine clinic or an urban hospital in London. We also have integrity. We follow ethical standards like being honest about a patient's prognosis, even when it's difficult. Another value is social justice. It's advocating for fair treatments, such as pushing for access to vaccines for underserved communities. Values clarification helps us identify and evaluate our own values, promoting self-awareness and empathy. For example, understanding our stance on euthanasia helps us navigate end-of-life care. In the Philippines, where Catholic values are prevalent, nurses often align care with spiritual considerations. In contrast, secular countries may prioritize patient autonomy. Clarifying our values ensures our actions align with our professional standards. The values clarification process involves 3 steps. We have choosing, pricing, and acting. Choosing alternatives thoughtfully is the first step. For example, deciding whether to prioritize a patient's autonomy or family wishes in treatment decisions. Pricing means the choice by affirming its importance. For instance, valuing honesty in explaining a critical diagnosis. Another step is acting consistently. For example, continuing to advocate for a patient's rights despite opposition. This process ensures that our decisions are intentional and aligned with ethical principles. As nurses, we must reflect on our values related to life, health, and ethical issues. We can consider our stance on abortion or end-of-life care. Filipino nurses often are influenced by religious beliefs and may prioritize life preservation, while nurses in progressive countries may focus on patient choice. Reflecting reflecting on these values helps us navigate ethically challenges with integrity. Understanding clients' values is essential for patient-centered care. For example, a client may prioritize family input in medical decisions, while another client may prefer making independent choices. As nurses, we must explore these values through open communication and use them to guide care plans. In practice, we must respect diverse values without imposing our own. For example, a nurse in the Philippines may encounter a patient refusing modern treatment in favor of herbal remedies. In this case, respecting the patient's choice while providing education on safe practices is key. Globally, respecting values like gender-specific care in Middle Eastern countries is equally important. Communication is the bridge to understanding and integrating these values into care. To summarize, ethical nursing practice relies on understanding and respecting values, whether in the Philippines or abroad. Core nursing values like altruism, autonomy, and integrity guide us in providing compassionate, ethical care. As we face moral challenges, let us be encouraged to reflect on this question. What values will I uphold to inspire ethical nursing care in my practice? The concepts of ethics and morality in nursing are not just theoretical ideas, but practical tools that guide us daily as we navigate complex and sensitive situations with our patients, families, and colleagues. Understanding ethics and morality helps us make decisions that align with our professional standards and values, ensuring the best possible care for our patients. Ethics refers to the study of morality and how it applies to human behavior. It helps us understand what is right and what is wrong, and sets the standards for moral behavior within a specific group, such as our nursing practice. Nursing ethics focuses on the unique challenges we face in our profession, like patient confidentiality, informed consent, and end-of-life care. For example, in the Philippines, where family-centered care is common, nurses must often balance patient autonomy with the family's input. This contrasts with countries like the US, where patient autonomy is prioritized. These cultural differences highlight the importance of ethical principles tailored to your patient's context. What is morality? Morality refers to a personal standards of what is right and wrong. These are influenced by culture, religion, and personal experiences. For us nurses, morality often manifests as an inner voice, guiding us to act ethically, especially in challenging situations. For instance, if you are a Filipino nurse caring for a patient who refuses treatment due to faith-based beliefs, you may feel torn between respecting your patient's decision and the moral duty to save lives. Ethics and morality are related but distinct concepts. Ethics involves a broader study of moral principles, while morality pertains to personal standards. Understanding this difference is crucial for nurses to navigate professional and personal conflicts. For example, A nurse might question the morality of withdrawing life support from a patient in a vegetative state. Ethically, the nurse must respect the family's decision if it aligns with medical guidelines and the patient's advance directives. This distinction is critical in balancing professional accountability and personal beliefs. Ethics and law often intersect but are not always aligned. Laws reflect societal moral values but may not fully encompass ethical nuances. For example, in the country, euthanasia is illegal. However, ethically, some nurses may feel that prolonging life through invasive measures contradicts the principle of beneficence or doing good. In countries like the Netherlands, where euthanasia is legal under strict conditions, nurses must still navigate ethical principles. That is to ensure that the patient understands their options fully. Ethics and religion often influence each other, but serve different purposes. Ethical principles are universal laws, but are secular, while religious beliefs are specific to faith communities. This distinction is vital in diverse settings. For example, a Jehovah's Witness patient may refuse a blood transfusion due to religious beliefs. The nurse must respect this decision while exploring alternative treatments that align with ethical principles of beneficence and non-maleficence. Moral development is the process of learning to distinguish right from wrong. It begins in our childhood and evolves through our experiences, education, and reasoning. There are two prominent theories of moral development, and they are by Lawrence Kohlberg and Carol Gilligan. In the Philippine context, moral development often incorporates strong familial and religious influences, emphasizing care and responsibility, which aligns with Gilligan's theory. Meanwhile, Western countries may focus more on individual rights, reflecting more on Kohlberg's principles. Kohlberg's theory identifies three levels: pre-conventional, conventional, and post-conventional. Each stage represents a deeper understanding of moral reasoning. For instance, a Filipino nurse in the pre-conventional stage might follow rules to avoid punishment. At the conventional level, they may uphold societal norms like respecting authority. At the post-conventional stage, they prioritize universal ethical principles, such as advocating for patients' rights despite institutional barriers. Gilligan's theory of moral development emphasized care and relationship over rules and rights. Her theory resonates with the Filipino value of bayanihan or communal unity, where decisions often consider the well-being of the group. For example, a nurse working on a rural health unit might prioritize community health by organizing vaccination drives, showing care for the collective rather than focusing solely on individual patients. Moral frameworks provide structured approaches to ethical decision making. Three main types are consequence-based, principles-based, and relationships-based frameworks. Each framework offers a unique perspective. For example, in the Philippines, a nurse may use a relationships-based framework to strengthen trust with a patient's family during end-of-life discussions, while a nurse in a Western hospital might focus on principles-based reasoning to respect patient autonomy. The consequence-based framework judges actions by their outcomes. Utilitarianism, a common approach, seeks the greatest good for the greatest number. For example, in our country, during typhoons or disasters, the Filipino nurses might prioritize resources for patients with the best chances of survival. In contrast, a similar approach might guide pandemic responses worldwide, such as vaccine distribution. The principles-based framework emphasizes rules, duties, and rights. Nurses following this framework act based on ethical principles like autonomy and justice. For example, a nurse might assist in obtaining informed consent for a procedure, respecting the patient's autonomy despite familial pressure to proceed with it. The relationships-based framework focuses on nurturing relationships and promoting the common good. A nurse providing emotional support to a family during a terminal illness demonstrates this approach, prioritizing care and connection over rigid rules. What are moral principles? Moral principles provide foundational guidance for ethical decisions. Key principles include autonomy, beneficence, non-maleficence, justice, fidelity, and veracity. These principles are universal but must be adapted to cultural contexts. Let us explore each of them. Autonomy refers to the patient's right to make decisions. We must respect this, even when they disagree with our decision. For example, a patient might refuse dialysis for whatever reason, and this should be respected. Globally, respecting autonomy might involve supporting a patient's decision to withdraw from a clinical trial. Non-maleficence means avoiding harm. This principle can be challenging when interventions carry risks. For instance, when we administer chemotherapy, this may cause severe side effects, but they could also save lives. We as nurses must weigh these risks carefully, ensuring our patients are well informed. What is beneficence? Beneficence is the obligation to do good. This principle often guides health promotion efforts. Every time we conduct health education campaigns in underserved communities, we exemplify beneficence. Or when we advocate for policies that improve access to healthcare. That is beneficence. Justice, on the other hand, focuses on fairness in care and resource allocation. Here in the country, we nurses often face challenges in distributing limited resources. But this should not prevent us from practicing and observing justice. Fidelity means being faithful to promises and responsibilities. For example, if you promised a patient to follow up on their pain management, fidelity requires ensuring this happens regardless of other priorities. Veracity or truth-telling is critical for building trust. For example, explaining a poor prognosis honestly to a patient while offering hope demonstrates veracity. In some culture, this must be balanced with family preferences to shield the patient from distressing information. Nurses must be accountable for their actions and recognize their professional responsibilities. This includes documenting care accurately and justifying decisions based on evidences and on ethical standards. Ethical principles must be adapted to cultural religious contexts. For instance, a Muslim patient might require gender-specific care, and a Jehovah's Witness may refuse blood transfusion. Nurses must respect these values while ensuring patient safety. Patient-centered care involves listening to our patients' values and preferences. For example, we are often involved in families in care planning, while in Western settings, the focus may shift to empowering the patient directly. Ethical dilemmas often arise in practice, such as balancing patient confidentiality with family inquiries. Using moral frameworks and principles can guide nurses to make decisions that align with both professional standards and patient care. In conclusion, ethics and morality are vital in nursing practice. By understanding moral frameworks and principles, we can navigate complex situations with integrity and compassion. Whether in the Philippines or abroad, let us strive to provide care that is ethical, respectful, and culturally sensitive. As nurses working in the Philippines, it is important for us to be familiar with our nursing ethics. Nursing ethics refers to the moral principles that guide nursing practice in decision making. It ensures that nurses act in ways that protect patient dignity and uphold professional integrity. Ethical considerations are particularly important in the Philippines, where healthcare access, disparities, and cultural values shape decision-making. The Code of Ethics for Registered Nurses in the Philippines is established by the Board of Nursing under the Professional Regulation Commission, or the PRC. It is guided by Republic Act 9173, known as the Philippine Nursing Act of 2002, which upholds ethical nursing standards. The Code of Ethics emphasizes professional responsibility, integrity, patient-centered care, and respect for human dignity. Ethical guidelines help nurses navigate moral dilemmas, particularly in government hospitals where resource limitations may pose challenges. What are the ethical principles in nursing? First, we have autonomy. Nurses must respect a patient's right to make their own healthcare decisions, even if it contradicts medical advice. Beneficence. Nurses should always act in the best interest of patients, promoting well-being and recovery. Non-maleficence. Nurses must avoid harm to patients, which includes preventing medication errors and ensuring safe healthcare environments. Justice. Equal and fair treatments should be provided to all patients, especially in our healthcare delivery system, where there are disparities in access to healthcare services. Fidelity. Nurses must maintain trust with patients by honoring confidentiality and upholding commitments. Veracity. Truthfulness is essential in all professional interactions, including delivering difficult news to patients and their families. Ethical dilemmas in nursing often arise from conflicting responsibilities toward patients, healthcare institutions, and the professional regulations. Technological advancements create new challenges, such as end-of-life decision-making and the ethical implications of artificial intelligence in healthcare. In the Philippines, issues of fairness in resource allocation are significant, as many government hospitals face shortages of medicines, equipment, and trained staff. Nurses often struggle with maintaining ethical standards while working in under-resourced healthcare facilities. What are common ethical issues in Philippine nursing practice? 1. Informed consent. Our patients must understand and voluntarily agree to procedures, but in some hospitals, language barriers and lack of education may pose challenges. End-of-life decisions. Nurses often handle do not resuscitate or DNR orders and palliative care, balancing ethical concerns with cultural beliefs about death. Patient confidentiality. Maintaining privacy is critical, especially in Filipino culture, where family involvement in medical decisions is common. Resource allocation. Government hospitals and rural areas often face shortages, forcing nurses to make difficult decisions about prioritizing care. How do nurses make ethical decisions? Nurses should identify the ethical dilemma by recognizing situations where moral principles conflict. Gather all relevant facts to fully understand the situation, including patient preferences, legal considerations, and institutional policies. Consider the Philippine Nursing Code of Ethics as a guiding framework. Evaluate all possible options and their consequences before making a decision. Once a decision is made, implement in a way that upholds ethical principles. Afterward, reflect on the outcome and identify improvements for future ethical decision making. There are some strategies to enhance ethical practice. Continuous ethical training and education should be mandatory for nurses to keep up with evolving ethical challenges. Hospitals should have ethics committee where nurses can seek guidance when facing moral dilemmas. Open communications between nurses, patients, families, and healthcare team fosters trust and ethical decision making. Nurses should advocate for patients' rights and ethical nursing practice, particularly in underserved communities. Strengthening professional accountability ensures that nurses adhere to ethical standards despite challenges in the healthcare system. Nursing ethics plays a crucial role in decision making, patient care, and professional integrity. We nurses face ethical dilemmas daily, influenced by medical advancements, legal policies, and cultural expectations. Some of these issues are highly sensitive, such as confidentiality, end-of-life care, and reproductive health. Understanding ethical principles helps nurses make informed and compassionate decisions. Ethical dilemmas in the Philippines are shaped by religious, cultural, and socio-economic factors. Nurses often struggle with issues related to patient rights, professional responsibility, and access to health care. The Philippine Nursing Act of 2002, or RA 9173, provides ethical guidelines to ensure high standards of nursing practice. A major ethical challenge is balancing patient confidentiality with public safety in HIV/AIDS cases. Nurses are legally and ethically obligated to protect patient privacy, as stated in the Philippine HIV and AIDS Policy Act, or RA 11166. However, there are cases where disclosure may be necessary to prevent the spread of infection. The role of nurses is to provide non-judgmental care while ensuring ethical and legal compliance. Abortion is illegal in the Philippines, except when necessary to save the mother's life. This presents an ethical challenge. How can nurses provide care without violating the law or their personal beliefs? Nurses must educate and support women about legal reproductive health services and family planning. They need to provide non-judgmental and compassionate care. Organ transplantation raises ethical concerns related to consent, allocation, and financial disparities. The Organ Donation Act, or RA 7170, regulates the ethical donation of organs in the Philippines. Nurses must ensure that patients and families fully understand the implications of organ donation. There is also a need to prevent illegal organ trade and exploitation of vulnerable individuals. DNR orders, or do not resuscitate orders, and palliative care are sensitive ethical issues. Many Filipino families struggle to accept end-of-life decisions due to cultural and religious beliefs. Nurses must act as mediators, ensuring that patients' wishes are respected while also supporting the family's emotional needs. Ethical nursing care includes pain management, emotional support, and respecting the dignity of dying patients. Some hospitals in the Philippines lack resources, including hospital beds, medications, supplies, and staff. This leads to ethical dilemmas. Who should receive treatment first? The ethical principle of justice guides nurses in ensuring fair distribution of healthcare services. Nurses need to be transparent, compassionate, and objective when making these difficult decisions. In today's digital world, protecting patient privacy is more challenging than ever. Nurses must follow the Data Privacy Act of 2012 or Republic Act 10173 to prevent unauthorized sharing of patient information. Ethical nursing practice requires strict confidentiality, especially in public hospitals where record keeping may be less secure. Advocacy is the process of standing up for patients and ensuring they receive quality care. Nurses in the Philippines often advocate for patients' rights, fair labor practices, and healthcare policy improvements. Through advocacy, nurses become leaders in promoting ethical and effective healthcare delivery. Nurses must inform patients about their rights and healthcare options. Supporting patient autonomy means respecting their choices even when they refuse treatment. Nurses act as mediators, ensuring that patients' needs are heard and met by healthcare providers. Nurses can influence policy change to improve working conditions and healthcare standards. The Philippine Nurses Association plays a key role in advocating for fair wages, safe working environments, and improved healthcare policies. Nurses also participate in health education campaigns to empower communities with knowledge about disease prevention and health promotion. Heavy workloads and lower salaries often prevent nurses from engaging in advocacy. Many fear retaliation or job loss when speaking out against unethical practices. Despite these challenges, nurses must continue to push for reforms that benefit both patients and healthcare professionals. What are strategies to strengthen nursing advocacies? 1. Strengthen ethical education for nurses to improve awareness of advocacy rules. Form alliances with professional organizations like the Philippine Nurses Association and the Department of Health to influence healthcare policies. Encourage patient participation in legislative advocacy to push for reforms that improve working conditions and patient care. Ethical issues in nursing require critical thinking, compassion, and adherence to ethical principles. Advocacy plays a crucial role in protecting patients' rights and improving nursing profession. Filipino nurses must continue to be champions of ethical and patient-centered care.